The last time we talked about why you don't enjoy sex. Why is it that everybody is telling you how pleasurable sex is and you are telling a different story? Why is it so? There are things that are making you not to enjoy this sex, and today we are going to trash it out under God. At the end of this video, I'm going to reveal to us remedies, perfect solution to all these factors that made you not to enjoy sex. We listed out so many reasons why you don't enjoy sex in my live video, but today we are going to point them one after the other, and this procuring solution to all the highlighted challenges that make you not enjoy sex will take place at the tail end of this video. Please make sure you watch this video to the end so as to gather the necessary information that will take care of this painful sex. We said one of the factors is vaginal dryness. Anything that makes your vagina to be very dry automatically make you to have pains. And something enters and comes out from there without any fluid that lubricates the pathway. You keep having collision. You keep having friction. And that friction is the pain that you are having during sex. And there are two major factors that can make your vagina to be dry. We said one is menopause. When you enter into the phase of life that you don't see your menses anymore, we call it menopause. And menopause results to a drastic reduction in the production of sex hormones. And you know that these sex hormones are the major factor that helps in the lubrication of the vagina. So when there's a short supply of these sex hormones in the system, the vagina becomes dry, and that dryness is what gives you pain whenever you're having sex. We said the number two is prolonged use of contraceptives. When you use contraceptive over time, either the one that is taken orally or the one you start in your vagina or the one you plant under the skin, over time, it keeps making your vagina very dry. Ensure that you watch this video to the end. We said number two cause of your painful sex is urinary tract infection along the urinary tract. It could be infection of the kidney, it could be infection of the ureter, the tube that carries urine from the kidney down to the bladder. It could be infection of the bladder itself, it could be infection of the ureter. The number two we talked about is ovarian cyst. If you have a fluid-filled sac on top of the ovary, that is what we call cyst alone can cause you to have pains whenever you're having sex. We say the number four is fibroid in the uterus. That is uterine fibroid. Anything that we call it myoma. Anything that make a tumor to grow from your womb, that make a tumor to grow from the uterus, automatically make you to have pains, especially when there is a penetration and withdrawal. When something enters and shake you and that then comes out, you keep having pain. We say the number fifth is cervical infection. Cervical infection is an infection at the cervix. And you know, cervix is the neck of the uterus, the neck of the womb. So infection at the neck of the womb is what we call cervical infection. So that infection at the cervix causes the cervix to be inflamed and swollen. So that swelling at that cervix makes you to have pains whenever you're having. The number six is endometriosis is just the internal lining of your womb. The inside of your womb, the tissue that lines it. If that tissue is found elsewhere in the system, if it's found on top of the womb, if it's found on top of the ovaries, if it's found on top of any organ, that is what we call endometriosis. And because that tissue is found where it's not supposed to be found, it results to inflammation and constant pains, especially when you're having. We say the number four, pelvic inflammatory disease, PID. This is an infection that is from the vagina to the cervix to the womb, which is the uterus, to the fallopian tube and down to the ovaries. So this tract, we call it the reproductive tract of a female. Infection on any part of this reproductive tract results to what we call PID. And this PID, the infection can be a fungal, it could be bacterial, it could be protozoan. So most times it's always an aggregate of these pathogens, bacterial, fungal, and protozoan, causing infection along the tract. And that infection along the tract results to serious inflammation of the reproductive system. And this inflammation causes you to have unbearable pains whenever you are having sex. Even if you're not having sex, you keep having pains. But if you're having sex, it worsens the whole pain. It becomes so aggravating. So that's one of the reasons why you happen when you are having about is bowel conditions. That is inflammation in the guts. That inflammation can be as a result of a disease called IBD or IBS. It can also be caused as a result of ulcerative colitis. That is anything that results to swelling of the guts. This tube through which food enters the body and goes out of the body. We call it GIT or gut. So Inflammation along the track of this gut results to a serious pains whenever you're having sex. As you are having sex, your body is shaking. So that shaking is also affecting the inflamed gut, and that is why you have pain. The number 9 is bladder conditions. When there is a serious infection of the bladder will be swollen, and that swelling is what gives you pains, especially when you are having sex. Other factors are emotional, like anxiety, depression, fear of intimacy, and low self-confidence. Now, back to the remedy to all of these factors. If what is causing you pain is vaginal dryness, and that vaginal dryness is as a result of menopause, you've entered into the stage of life you don't have, go for moisturizers, things that help to lubricate the cervix, things that help to lubricate the vagina, make it moist so that as soon as something is entering there, there will not be friction. Number 2, you go for lubricant. That's lubricant, just like the name implies, any oil that helps to lubricate the vagina. And that oil will have so many brands of that. We have KY jelly, we have so many brands of lubricants. So before you have sex, apply the lubricant. It will avert friction in that area. By so doing, pains during sex become a thing of the past. If you do use contraceptive, and that contraceptive is one of the factors that is making your vagina to be dry, I advise that you discontinue with that contraceptive. Discard it and ensure that before you undertake or before you start any sexual intercourse, ensure that there is a foreplay. Ensure that your man touches those sensitive areas. If he doesn't know those areas, you need to tell him. Just teach him those areas. He might not know, but just give him signal, let him touch you those areas. And as those areas are being touched, there is a stimulation of a liquid, production of a liquid called endorphins. The endorphin helps to kill every pain that might emanate from that sexual intercourse. So if urinary tract infection is why you don't enjoy sex, maybe there is infection of the urinary tract, that is the tract through which urine is being produced and it's out of the system. If it's urinary tract infection that is making you not to have pains, one thing you do is your doctor might recommend a whole lot of antibiotics, but I recommend a cephalosporin. An example of this cephalosporin is cefalexin. This cefalexin is most effective in taking care of this urinary tract infection, and it's even safer in pregnancy. That means if you are pregnant and there is need for UTI to be treated so that you enjoy sex, my dear, this cephalosporin is an antibiotic that you can even do in pregnancy. I recommend immune boosters like higher strength of vitamin C that help to boost your immune system and reduce your effectiveness. We also recommend an antihistamine like loratadine or piriton or any of the antihistamines that help to relieve you of that itching sensation that you receive as a result of infection. If your pain is as a result of ovarian cyst can just go unaided. It can just go without medication. But if it persists, you could do contraceptives or you go for surgery. If your pain during sex is as a result of in the womb, my dear, this sex hormone, this female sex hormone is one of the things that feed this fibroid. So anytime there is a drastic reduction of female sex hormone, fibroid shrinks. So the remedy to this fibroid is suppression. Go for medication that will suppress the production of this female sex hormone. This sex hormone like estrogen, progesterone, the suppression medication that will help to suppress these hormones will automatically give you a shrinking effect on that tumor which is in the womb called fibroid. If what is making you to have pain is as a result of cervical infection, that is infection of the cervix, it's ideal that you run do a lab investigation to know the particular pathogen causing you that infection in the cervix so as to know the right antibiotics to take and get rid of that infection in the cervix. If endometriosis is what is making you to have pain, that is a tissue of the uterus appearing in another area of the system. If that is a problem while you are having sex, my dear, we recommend that you take pain medications, especially if you are not an ulcer patient. But if you are an ulcer patient, there are still other painkillers that are GIT friendly that help to relieve pains but doesn't trigger ulcerations. Like celecoxib is fine. It's a very good potent anti-inflammatory and still don't trigger us. We also recommend that you do some contraceptives that will keep relieving you the severity of the symptoms of endometriosis. You can still do androgen. An example of this androgen is danazole. It's a brand of androgen that help to reduce the severity of the symptoms of endometriosis. If pelvic inflammatory disease like PID is what is diagnosed that is causing your painful sex, that is causing you to have pain whenever you are having intercourse, I recommend you run lab investigation that will point out the pathogens involved in the cause of this PID. And as soon as the pathogens are implicated, right antibiotics could be a member of the cephalosporin family, Remedies, and the host of all these things. Example of what I just said now is cefuroxime, tinidazole. All of these things are the right medication you can use to take care of this PID, especially if the pathogen is sensitive to cephalosporins and these nitroimidazoles. If you have an inflammatory bowel syndrome, that is the gut, the GIT, is swollen. If you put in anything in the mouth, you go to toilet, or you become very constipated. That thing is one of the reasons why you are having pains whenever you are having sex. How to take care of that is you do good painkillers that doesn't trigger ulceration, and also do immunosuppressant steroids that help to reduce immunity. Most times, the cause of these bowel conditions, that's inflammation of the GIT, inflammation of the gut, is autoimmunity. When the body's immunity stands to fight against body cells, it results to inflammation in the bowel, in the stomach. So that inflammation in the stomach can be suppressed, can be taken care of by suppressing the immune system, and the inflammation disappears. The right medications like dexamethasone, prednisolone, but not for a long time, because a long time of intake of this can actually result in another thing. Just do transiently these immunosuppressants, reduce your immunity, and the autoimmunity becomes a thing of the past. If your painful sex is caused by bladder infection or bladder conditions, we recommend you just run a test, know the particular pathogen causing your bladder to be inflamed. As soon as it's known, do the right antibiotics, take anti-inflammatory, you'll be fine. The last but not the least, if your painful sex is traceable to emotional conditions or emotional problem, I advise you to condition your mind. Stop being anxious. Be stable. Tell yourself that sex is meant to be enjoyed and not to be endured. Tell yourself as you're going to have this sex now, you will never feel pains. Just condition your mind. Don't be scared. Have self-confidence that you can do it better. And by doing this, the pain just disappears. Whenever you want to have a sex, always ensure that you run a foreplay, you do a foreplay. Let your man touch those sensitive areas so that this hormone that we call happiness hormone will be secreted and pains will be averted. Thank you for watching. Please don't forget to subscribe to my channel and turn on this notification button if not done, and also turn on this notification button so that you receive notifications whenever we do a new video. Thank you.